Hello learners, greeting of the day and welcome to this session where we are going to discuss nutraceutical products for diabetes, cardiovascular diseases and cancer. So, I am going to first tell you a little about the physiology of these diseases, what is diabetes, cardiovascular, what are the different kinds of cardiovascular diseases and what exactly is cancer, and we will also discuss different kind of nutraceutical products which can be used along with the main conventional therapy, or they can be used as wellness products before the onset of these diseases. Like we saw earlier, nutraceuticals is a broad umbrella term that is used to describe any product derived from food source, herb source or a natural source with extra health benefits in addition to the basic nutritional value found in foods. The term nutraceutical combines two words, nutrient, which is nourishing food component, and pharmaceutical, which is the medical drug. So, it is a baby born to nutrition and pharmaceutical, and food, when it is made into a kind of pharmaceutical dosage form or used as such, we call it a nutraceutical, and this name was first coined by Stephen D. Fellis. Let us first talk of diabetes. We commonly hear about the rising blood sugar levels. Diabetes mellitus is a group of metabolic disorders in which the body does not produce enough or any insulin or does not properly use the insulin that is produced or exhibits a combination of both. So, when you see such a state, such a disease state of the body is called as diabetes. When any of these things happen, the body is unable to get sugar from the blood into the cells. So, as a result, the blood sugar levels are very high, and also since the body cannot use this sugar, there is no energy for the cells. The symptoms often include frequent urination, increased thirst, increased appetite and health complications like skin infection, nerve damage, kidney damage, etc. Acute symptoms include ketoacidosis, hyperosmolar, hyperglycemic state and death. Serious long term conditions include cardiovascular disease, stroke, chronic kidney disease, foot ulcers, damage to nerves, eyes and cognitive impairment. What is the role of insulin? Why is insulin important in maintaining these sugar levels in the body? So, when the blood sugar levels rise, so when we eat any kind of food which contains carbohydrate, the body absorbs sugar from this and this sugar is then present in the blood. So, when the blood sugar levels rise due to ingestion of carbohydrates, the pancreas gets triggered to secrete a protein called insulin. So, pancreas is an organ in the body which secretes insulin, which is responsible for maintaining or use of this sugar. This protein roams around in the circulatory system and sticks to the insulin receptor, which are found on the cells around the entire body from skeletal muscles to fat cells. The attachment of insulin to these receptors will trigger the cells to take in floating glucose. So, this glucose is floating all over the body and the cells which have insulin will take up this sugar and eventually turn it into energy which is needed for functioning of the cells. So, you can imagine in absence of insulin, this sugar will keep roaming in the body and the body will not get energy from the glucose or sugar. This all means that the cells in our body do not function properly without insulin because there is no energy. Diabetes is classified into into different types. The main type is type 1, type 2, but there is gestational diabetes which occurs in pregnant mothers. But the major classes are type 1 and type 2. Type 1 diabetes is, this is the pancreas, which the beta cells of pancreas secrete insulin. So, type 1 diabetes is caused by autoimmune disease. What is an autoimmune disease? The body's own cells start attacking different organs. So, when they start eating the pancreas cells and they attack the beta cells, there is no insulin produced. This is type 1 diabetes. Type 2 diabetes is, the cells are there, but they are not producing sufficient insulin. There is no insulin. So, in both the cases, the body does not get insulin. The reasons are different, but the end result is there is no insulin available for the sugar to be converted into energy. So, in such cases, when the sugar remains high, what are the different kinds of nutraceuticals which are useful? So, since the sugar is high, the first step is to avoid food which has a large amount of carbohydrates. So, one can shift to food with dietary fiber. For example, oats, which contains a high level of beta glucan, which is highly viscous soluble fiber. This reduces elevation of postprandial glucose due to consumption of food. Therefore, it has beneficial effects on glucose metabolism. These soluble fibers increases the satiety, or it gives a full feeling of fullness, and hence a person will not feel like eating more carbs or more food. It slows down absorption of glucose and hence is beneficial to diabetes. Phytochemicals which are rich foods and which can be used as nutraceuticals. So, they improve the glycemic control, it reduces the HbA1c. HbA1c is the average sugar which is there in the blood for last 3 months. So, when you go for blood test for diabetes, generally this value is preferred to see that for how long the sugar levels are high in the blood. It improves the triglyceride levels and enhances antioxidant defense mechanism, attenuated oxidative stress is low and the inflammatory markers are low. So, in cases where the free radicals are attacking the pancreas, use of antioxidants as nutraceuticals will help improve the disease state. So, these nutraceuticals stimulate insulin secretion from the pancreas, thus modulating glucose release from the liver. They activate insulin receptors and glucose uptake in insulin sensitive tissues and modulate intracellular signaling pathways and gene expression. They thus reduce the risk of type 2 diabetes. An excellent nutraceutical, easily available, very economical is lycopene, obtained from tomato. Lycopene, there are different sources of lycopene. Watermelon, berries are also rich in lycopene, but tomato, at least in India, is very easily available, and this is a naturally occurring carotenoid pigment found in red colored fruits. Tomatoes, watermelon, pink guava, papaya and red peppers are a rich source of lycopene, and lycopene is an excellent nutraceutical which can be used for diabetes. It is a very powerful antioxidant known for its role in reducing oxidative stress. It helps in inflammation, both of which are major contributors to diabetes. So, when there is oxidative stress and an inflammation of the pancreas, it leads to less secretion of insulin. So, lycopene helps in protection against both of these. It improves the glucose uptake by enhancing the insulin signaling pathway via the GLUT4 transporters in muscle and adipose tissue. It also decreases hepatic gluconeogenesis and glucose production by the liver. Protection of the pancreatic beta cells, very important, helps in regeneration of the beta cells and reduces apoptosis or cell death caused by oxidative stress. A class of actives called flavonoids are also very useful as nutraceuticals in diabetes. These are a large group of polyphenolic compounds which are found abundantly in fruits and vegetables. So, these are found in daily fruits and vegetables that we consume, and they are known for their antioxidant and anti-inflammatory activity, insulin sensitizing properties which help in prevention and management of diabetes mellitus and their complication. So, different class of flavonoids like the flavones, example is apigenin and luteolin, which is found in parsley and celery, flavanols which is quercetin and camphorol, they are found in onions, kale and apples. So, just include a lot of onions in your daily food, this will act as nutraceutical. Flavanols is example is naringin and hesperidin. Consume a lot of citrus fruits, flavanols, epicatechin, green tea and cocoa, and isoflavones, genistin and diazenin, soybeans and legumes. Anthocyanins are in berries and red grapes, but these flavonoids are present in these food sources, but these food sources also come with a quantity of sugar. So, one needs to balance properly the diet in right quantities. The mechanism of flavonoids as anti-diabetes, they act as antioxidant and they act on multiple molecular targets. Antioxidant is one of them, where these flavonoids reduce the oxidative stress which damages pancreatic beta cells. They act as excellent free radical scavengers and enhance the antioxidant enzymes. They also enhance the insulin secretion. So, certain flavonoids like quercetin and camphorol are known to stimulate insulin secretion by protecting the beta cells of pancreas. They help in modulation of glucose metabolism, they suppress the hepatic gluconeogenesis and glycogenolysis, thereby reducing the hepatic glucose output. They are anti-inflammatory and they help in maintaining the lipid profile improvement. Another class of compounds which are useful as nutraceutical in maintaining the diabetes, anthocyanins which are water soluble flavonoid pigments. So, anything that looks colorful, the purple cabbage, berries, red cranberries, all these contain anthocyanins. They possess potential antioxidant, anti-inflammatory and anti-diabetic activity. They are found abundantly in berries, blueberry, blackberry, blackcurrant, in cherries, grapes, purple cabbage, eggplant and red rice. Anthocyanins act through multiple mechanisms to improve the glucose metabolism. For example, inhibition of carbohydrate digesting enzymes, they inhibit the alpha amylase and alpha glucosidase enzyme in the intestinal tract. This slows down the breakdown and absorption of carbohydrates. This mechanism is similar to agarbose, an anti-diabetic drug used in conventional therapy. Enhancement of insulin sensitivity is seen with use of anthocyanins. They improve the insulin receptor signaling by activating the AMP activated protein kinase and the PI3K pathways. These pathways promote the GLUT4 translocation to the cell membrane, facilitating glucose uptake into the muscle and adipose tissue. The result is better glucose utilization and lower blood glucose levels. They also act by protection of the pancreatic beta cells by reducing the oxidative damage because of their strong antioxidant properties. Coming to the cardiovascular diseases, especially post pandemic, the maintaining cardiovascular diseases has become very important by use of different kind of foods or nutraceuticals. Different types of cardiovascular diseases are the heart and blood vessel disease, which includes numerous problems. Most of them are related to atherosclerosis, where there is a deposition of plaque in the blood vessels. This occurs in the artery walls, where the artery walls are damaged from oxidized low density lipoproteins, initiating an inflammatory response. The intestinal cholesterol comes from our diet and from liver synthesis, which is sent with the bile into the intestine. So, deposition of cholesterol also causes heart diseases. It is then absorbed into the blood through intestinal wall and transported via lipoproteins. So, mechanism of nutraceuticals in the heart health is by various mechanism: reduction in insulin resistance, sugar binding to cholesterol forms a plaque and deposits in the blood vessels, reduction in oxidative stress, reduction in inflammation, promotes degradation of fatty acids. Nutraceuticals reduce the effect and risk factors on gene expression. They improve the endothelial function, it inhibits fat absorption, it helps in maintaining the cholesterol synthesis, thus helps in less deposition of cholesterol in heart vessels, and it helps in daily aging. It delays the aging. Further, cardiovascular diseases are the leading cause of death worldwide. Like I said, the post pandemic, it has become very important to have wellness in these different kind of cardiovascular diseases. They involve the heart muscles, heart walls, blood vessels and the electrical conduction system of the heart. Continuing the different kind of cardiovascular diseases, the coronary heart disease, where there is narrowing or blockage of the coronary artery because of atherosclerosis. This is the kind of deposition. You can see here the normal blood vessel. So, the amount of blood flow in the normal blood vessel and what happens when the blood vessel gets packed with plaque. So, this can be because of deposition of cholesterol, lipoprotein, sugar, etc. So, the blood flow has resistance. Cerebrovascular disease, this is a disorder of blood vessels supplying to the brain, and this leads to ischemic stroke, hemorrhage and the transient ischemic attack. Peripheral artery disease, narrowing of arteries supplying the limbs. So, these are all diseases because of blockage of arteries, and the symptoms involve leg pain during walk, numbness, ulcers and poor wound healing. Rheumatic heart diseases, damage to the heart walls, heart muscles caused by rheumatic fever, a complication because of throat infection. It also affects the valves, and the symptoms involve breathlessness, fatigue, palpitation and heart murmur. Congenital heart diseases where there is septal defects, valve defects, tetralogy of the fallet, and the symptoms lead to different cardiovascular diseases. This is seen in infants, heart failure caused because of hypertension, cardiomyopathy and valve disease, and these symptoms are shortness in breath, swelling in legs, fatigue, fluid retention. Role of nutraceutical in these vascular diseases. Nutraceuticals play a very important role. They have a triple play in cardiovascular diseases and is now the central calling for the nutraceutical industry. This is because of large number of multiple mechanisms and an holistic healing which these nutraceuticals give. There are three strategies where these nutraceuticals can offer prevention and they can reverse the vascular disease. The first is by reducing the levels of low density lipoprotein cholesterol by forming micelle with bile salts. The second strategy is to reduce the possibility of oxidation, and the third is to reduce the artery plaque by dissolving it. What are these nutraceuticals? Sterols, stanols, phenols, flavones, which are plant derived compounds and they help compete with the cholesterol for formation of micelles. So, if the cholesterol does not bind to bile salts, it will reduce the plaque formation and it also is not absorbed in the bloodstream. So, these plant which contains sterols can be used as excellent nutraceuticals. The significant amount appears in vegetables, nuts and seeds. So, day to day consumption of these regular vegetables, nuts and seeds may help reduce the vascular diseases. Plants favored for sterol, stanol extraction include corn, soybean and wheat also. A unique commercial form of sterols are found in microphyte. Lot of phenols have shown to reduce cholesterol levels. Polyphenolic catechin which is found in green tea. So, people are now shifting to consumption of green tea beverages which helps in maintaining the cholesterol levels and hence improving the vascular diseases. Tea and its catechin are useful in suppressing the free radicals and stimulate the nitrous oxide for improving the cardiac health, hypertrophy protection by protecting the mitochondrial damage, hyperglycemia improving endothelial dysfunction by decreasing the angiotensin by inhibiting the ACE suppressing hypertension, angio conversion enzyme. The super fibers which are used as nutraceuticals which are found in plant foods like fruits, vegetables and whole grains. So, you must have seen that there are whole grain breads now available in the market, the multi-grain attas available in the market which help in wellness of cardiovascular diseases. Fibers are of two types, soluble fibers and insoluble fibers. Soluble fibers which comes from gum and pectins which dissolve in water. Examples are beans, fruits like strawberry and banana and oats. Insoluble fibers which come from cellulose and hemicellulose which are found in bran and leafy vegetables. The natural fats which are useful in maintaining the cardiovascular health, this comes from omega 3 fatty acids. Some of them are also found in marine plants and algal sources. Vegetable oils like soya bean, sunflower and peanut and almond oil also known to contain omega 3 fatty acid which is help in maintaining the cardiovascular diseases. Furthermore, the dietary tripeptides such as valine, prolyl, proline and the isoleucine proline, which is from cultured dairy products, have shown to improve the vascular health. The tocotrienols, which are an important constituent of the vitamin E family, is known to give important cardiovascular protection. The positive effects on the cholesterol level result from an ability to down-regulate a liver enzyme involved in cholesterol synthesis, and thus they form an important group of nutraceuticals in cardiovascular protection. Vitamin D has shown to regulate the blood pressure in arterial walls to kidney. The sources of vitamin D is sunlight, enough sunlight which helps in synthesis of vitamin D, fish oils, egg yolk, butter, liver and fortified foods are made with vitamin D. Panthitin, which is now finding a large use in cardiovascular protection, and it reduces the cardiovascular risk by inhibiting platelet clumping and production of the inflammation producing chemical. This is found in milk, egg, peas, starchy vegetables and cereals. Lycopene, which we saw earlier also, is a powerful antioxidant and it neutralizes the reactive oxygen species, thus prevents the oxidative damage, helps in improvement of lipid profile, also acts as anti-inflammatory. Coming to the third disease where nutraceuticals are finding a large use is cancer. This is a diverse group of diseases characterized by uncontrolled growth of abnormal cells. Cells divide rapidly and frequently than the normal cells in an uncontrolled manner, thus producing tumors and then going on to become malignant. Tumors have a definite growth stage, but when it turns malignant it converts to cancer. The major type of cancers: carcinomas, sarcomas, melanomas, leukemia and lymphomas. So, melanoma is a cancer of pigment in the skin. Carcinoma is any external or internal part of the body. Sarcoma is cancer of bones and cartilage. Lymphoma is the cancer of lymph, and here leukemia is cancer of blood. So, when these blood cells start multiplying in an uncontrollable manner, we term it as cancer. So, cancer affects the central nervous system, head, neck, the endocrine system, breast, reproductive systems, the skin, lymph, gastrointestinal, the gut, stomach, liver, the hepatobiliary system and the respiratory system when it affects the lungs. Mechanism of anti-cancer action of nutraceuticals is they act as antioxidants, anti-inflammatory, induction of apoptosis. So, it promotes or it induces a programmed cell death. So, when these cells are multiplying, these nutraceuticals put a break there by introducing a programmed cell death. Role is chemoprevention, and phytochemical molecular studies support their role in cancer prevention and has evidence from agents like tamoxifen and raloxifene. The key bioactive compounds which have found useful in cancer prevention are flavonoids, carotenoids and caffeic acid and phenyl ether. ester. Curcumin, garlic derived allyl sulfates are used as nutraceuticals, and the nutraceutical research is advancing towards cancer chemoprevention, focusing on apoptosis mediated mechanisms. There is a lot of scientific data being available which shows that cancer can be prevented, can be treated with use of these nutraceuticals. So, to summarize, diabetes, the key nutraceuticals are lycopene, flavonoids and anthocyanins, and commonly available source of nutraceuticals are tomatoes, berries, green tea and soy fruits. They act as antioxidant, improves insulin sensitivity and inhibits the carbohydrate digesting enzymes. In cardiovascular, the key nutraceuticals are again lycopene and flavonoids, omega 3 fatty acids, resveratrol which is obtained from grapes, and they have a role as antioxidant, lipid lowering, anti-inflammatory. So, if you see here, a lot of nutraceuticals are common. So, these nutraceuticals when taken can be commonly used as a wellness agent for an array of diseases. For cancer, again we have curcumin, resveratrol, lycopene, and this also acts as antioxidant, anti-inflammatory, induces apoptosis, inhibits angiogenesis, modulates signaling pathways. Angiogenesis is formation of new blood vessels. So, when new blood vessels are formed, it supplies growth to the cancer cells or a tumor. So, when you cut off that blood vessel supplying blood to a tumor, the tumor dies. So, inhibiting angiogenesis is a way to reduce the tumor and cancer. It prevents DNA damage and supports chemo prevention. These are the references, and thank you.